Good morning, good afternoon, everyone. And my name is Sofiat Akinola. I'm at the World Economic Forum where I lead the portfolio that we have on value-based healthcare. It's really a pleasure to be here today to present the work that we're doing at the World Economic Forum on value in healthcare. So I'll be spending the next 20 minutes with you, telling you about the work that we're doing in that space and our hope for the future in terms of transforming the healthcare system. Before I get started, for some of you that might not be aware of what the World Economic Forum is, so the World Economic Forum is the international organization for public-private cooperation with the mission to improve the state of the world. And we do this by bringing together key stakeholders of the global society to shape the future. So when it comes to value-based healthcare, as some of you know, some people call it value-based healthcare, some people call it value in healthcare. This term is really a concept of value-based healthcare was introduced by Michael Porter, a professor from Harvard Business School, and Elizabeth Teisberg from University of Texas in Austin in 2016. And since that, the concept of value-based healthcare has been introduced, I think it's been on everybody's mind. Everyone is interested to know what is value-based healthcare? How can we implement value-based healthcare? So what is value-based healthcare? There's several definitions around, but I would like to start with this. So value-based healthcare is a healthcare delivery model in which the provider, including the hospital, the physician, are paid on patient outcome. I think the key here is patient outcome, because what we want to focus on is we want to focus on the outcomes that matter most to the patient. This is how we shift from a traditional model to actually a value-based healthcare model, where in a traditional system, most likely, people don't really listen or care much about what the patient wants. But the shift to value-based healthcare is actually you're listening to the patient and thinking, what is it that you want to, what is it that you want to achieve, and how can we help you to achieve those outcomes? So focus on outcomes that matter most to the patient. And where does the value in value-based healthcare comes from is by looking at, measuring the outcomes that matter to the patient and the cost of delivering those outcomes. So value-based healthcare is not just a concept, but it's about doing things differently. So like I said, you're focusing on the outcome that matter most to the patient, and you're looking at the cost of delivering those outcomes. So you're looking at the efficiency and effectiveness of the care that is given and the cost. So when we also look at the health and healthcare ecosystem, value also means different things to different stakeholders in that ecosystem. So when you take the patient, with the patient is you want to be able to spend less money to achieve better health. What does that mean? You want to focus on patient, helping the patient to recover from illness and injury more quickly. You want to be able to prevent health conditions. So for example, chronic diseases in the first place. When it comes to provider, you want to achieve efficiency and greater patient satisfaction. So basically, currently, most of you probably have experienced it when you go to the physician, you're basically in and out. With the shift of value, what you're focusing on is actually you're able to spend more time with your provider. By spending more time with them, in terms of the quality of the care, the patient management, and also can start to talk to you about more of a prevention-focused care. And eventually, we're able to spend less time on chronic diseases because we're able to prevent from an earlier stage. Then we have the payer. So they want to be able to control the cost and reduce the risk. So by having a healthier population, what happens is there are fewer claims into making payment for healthcare. And then when it comes to the supplier, one of the focus right now is how do we align the prices with patient outcome? So how do we look at the suppliers in terms of the healthcare industry? Looking at the manufacturers, for example, when we're talking about therapeutics, how do you tie the prices of drugs to the actual value to the patient? And lastly, what happens if you're able to focus on value is the society becomes much healthier, and we reduce the overall cost of healthcare spending. And by that, we're able to free up money to be able to use that money for prevention. We're able to maybe use that money for education. We're able to use that money to improve the overall quality of life and well-being. So when we talk about value, some people might just think it's just about healthcare delivery system, but it actually impacts our overall system as a whole. So why value-based healthcare? And one of the things we need to know, first of all, when we look at the population, our population is growing. By 2050, we'll be about at 9.7 billion population of people on this earth. We know we have to do things differently if we are to care for the population increase that we're going to see. And we know currently with the healthcare system, it's not sustainable. Cost is growing. So for example, it is estimated that by 2040, we will spend about $25 trillion on healthcare. This is 150% increase in spending since 2014. And also on an annual basis, we spend about 3.2 trillion of healthcare spending that contributes that has minimal or little contribution to good health outcomes. So we know we have to do things differently. And I think this is why value-based healthcare is very important, because it helps us to shift from a traditional system to thinking about value and also outcomes that matter to the patient, and also looking at the cost of delivering those outcomes. Our current state right now is where we focus on volume. A lot of people, physicians are paid for volume. There's no systematic assessment of the quality of services. Now the challenge is, since the world is infatuated by this concept of value-based healthcare, the challenge now is how do we scale? How do we implement value-based healthcare? And I think the work that I will talk about later on, that is what we are focusing on in terms of how do we scale and how do we transform the healthcare system. So if we're able to implement value-based healthcare, our desired state is, we transition from the current system here of volume to actually value, where we're able to improve access to appropriate care. We're able to improve the quality of care. And we're also then able to use this to support innovation. If we have money that we're able to save from our healthcare, we can actually use that money, like I said, for prevention, and then to put into innovation to help us to continue to prevent and deliver better treatment. So kind of just giving you an overview of what value in healthcare means and what is the current state and what the desired state is. So what are we doing at the World Economic Forum to realize this goal of health system transformation and of value-based healthcare? At the World Economic Forum, we formed the Global Coalition for Value in Healthcare in 2019. And basically, this is a public-private platform that we want to use to accelerate value-based health systems transformation. So how are we doing that, and how do we get started on that journey? Our journey in value in healthcare began in 2016 when we formed a collaboration with Boston Consulting Group. And what we did with Boston Consulting Group was basically listen to what was being, like I said, 2006, the concept of value-based healthcare. Fast forward 10 years after 2016, no progress have been made. And we were listening to all things that, the health and healthcare stakeholders were talking about. We are interested in value-based healthcare, but we don't know how to do it. So what we started was in 2016, what we did was look at the landscape. And in the first year of the project, we called that laying the foundation for health systems transformation. So our goal was basically to demonstrate that value-based healthcare is necessary and value-based healthcare is really important for the future health system. And in that first year, one of the framework that we released with Boston Consulting Group, BCG, is we call that the enablers framework. And this framework is basically a comprehensive framework that identifies 5 enablers that are very important to transition to a value-based healthcare system. The first is health informatics. It is very important that we are able to collect data, and we do that systematically. And while we're collecting the data, we have to decide, how do we want to collect the data? How do we want to use it? Do we have the right systems in place to help us to collect that data? Then we look at value-based payment. And currently, most of the payment is focused on volume. But how do we start to shift the narrative where we actually focus on paying for the outcomes that really matter to patients? Because this is the key of value-based healthcare, to look at that, to how do we pay for those outcomes and the cost as well, so the efficiency. Then the third is benchmarking. Now that we've been able to collect data, how can we start to use that data to be able to improve the care that we give for continuous improvement, to do predictive analysis, and eventually to be able to provide more precise and personalized care. Then the fourth, we call it delivery organization. You can call it integrated system model. Is basically how do we also currently shift from the current way that we provide care, which is siloed, but to actually put in the patient in the middle of the care and then wrap around all the services that the patient needs in their care pathway. And of course, for all of this to happen, for us to have the health informatics in place, for us to have value-based payment, for us to have benchmarking and integrated practice model, it has to exist in a policy framework that supports the shift. As you all know, for anything to happen, it has to happen in a policy framework that actually provide that capacity to be able to shift. And that is no different for value-based healthcare. In the second year of the project, what we started to do is looking at the enablers that we framed in the first year of the project is how can we start to implement this and see what are the barriers, what are some of the opportunities. So what we did was we started to mobilize stakeholders for health systems transformation, and we developed 2 demonstration projects. One was focused on type 2 diabetes in Ontario, Canada. The second one is on heart failure in Atlanta, Georgia. And basically, like I mentioned, the goal of this demonstration project is how can we test the vision of the implementation of value-based healthcare in the real world, and what are some of the things that we need to change? What are some of the stakeholders that need to be involved in this work? And what are the systems that also need to be part of this process? In the third year of the project, we call accelerating the pace of health systems transformation. So what we wanted to do is look at what we learned in our first year and second year, and how can we use that knowledge to accelerate the pace of health systems transformation? And one of the things we started to notice was there's this gap where a lot of people were struggling with how to implement value-based healthcare. So when we launched the Global Coalition for value-based healthcare in 2019 at our annual meeting in Davos, this was basically the goal of the Global Coalition, is to create a global learning system where we can make examples, best-in-class examples of value-based healthcare implementation accessible, not just to only our core partners, but actually to the wider public, so that this knowledge can then accelerate the transition to a value-based healthcare system. Because we listen to people, the gap is they don't know how to do it, or they've been able to do it, but they don't know how to scale. So the benefit and the goal of this coalition is then to create that global learning ecosystem to make learning widely accessible. So for this to happen, like I mentioned before, with value-based healthcare is a continuous improvement, is about iterative learning, and we cannot do it in vacuum. Partnership is very important, where you have to work with different partners. You have to work with separate stakeholders to learn what they're doing, how they've been able to implement, what are their successes, what are their challenges. We need to be able to establish a network that will also facilitate our learning and help to scale up the implementation of value-based healthcare. And lastly, we call it knowledge curation. Knowledge is also important because we just don't want the knowledge to sit with a few. How can we make this knowledge actually widely accessible to help us to truly accelerate the implementation of value-based healthcare? So to help us to do this at the World Economic Forum, we've actually put together our executive board. And these are the executive board members for the Global Coalition for Value in Healthcare. And the goal of the executive board is to provide us with the strategic leadership and guidance in the implementation of the strategic priority that has been identified, and also bringing their knowledge into what they see in the current system, What is it that this correlation should focus on? And how can this correlation move the needle when it comes to value-based healthcare? And we have a diverse executive board member because for us, it's very important that we have diversity when it comes to representation. So diversity when it comes to areas of focus, diversity also when it comes to regional diversity as well, to see how value-based healthcare has been implemented across the globe and also different areas of implementation as well. So one of the ways where we're advancing and accelerating the transition towards a value-based healthcare system is through one of the work that we do on our platform, which is called the Global Innovation Hub for Value in Healthcare. So the the Innovation Hub for Value in Healthcare is very important because, like, one of the things that I mentioned in the beginning is people are interested in the implementation of value-based healthcare, but they don't know how to do it. Or some people have started to implement, but they haven't been able to scale. So the goal of the Global Innovation of Value in Healthcare is actually to look at what are some of the best-in-class examples that are evidence-based that serve as a proof of concept of value-based healthcare initiative that currently exist. How can we learn from them in terms of what have they been able to do? What are the challenges? What are their opportunities? And how can we make that learning widely accessible? And in addition to that, how can we use our platform to help them to continue to grow? Because one of the things is there's no perfect system. We're not looking for perfect system because it doesn't exist. So what is really important for us is when we look at this best-in-class example, is to look at their readiness to move towards a value-based healthcare system and how they've been able to demonstrate that readiness. So on March 25th of this year, of 2021, one of the things we did was we actually launched the first cohort of the Global Innovation of Value in Healthcare. So we've been working with each of these innovation hubs since last year, where we have a really rigorous due diligence process that we have in place to help us to truly qualify and do our due diligence to ensure that actually this innovation hub, these initiatives are actually first implementing value-based healthcare principles. 2, they're innovative, and 3, they serve as a proof of concept for value-based healthcare. And on March 25th, when we announced the 4 hubs, the 4 are: 1 is Health Cluster Portugal. So Health Cluster Portugal is very interesting because of what they do in terms of implementing value-based healthcare principle for cataract surgery. And it's very also interesting because it's not that you have a patient come in, they have the cataract surgery and they leave, but it's what happens to it. Like I said, value-based healthcare is about focusing on the outcomes that matter to the patient. And I think that is what Health Cluster Portugal for their cataract initiative has been able to do. Listening to the patient, what is it that you want? What is it that you want to achieve after this surgery? So for example, there's some patient that maybe they love reading and they want to continue reading. Or a patient that wants to play golf. How do we ensure that the lenses and the type of services that they get actually improve their quality of life and they can continue to live their life and continue to live a fulfilled life post-surgery? When you look at Diabeta is based out of the Netherlands, and also they are using value-based healthcare principles to implement type 1 diabetes. And as you look at type 1 diabetes or type 2 diabetes, most of the time, this is a chronic disease which has a long-term impact on individuals living with type 1 or type 2 diabetes. So also looking at using value-based healthcare to transform the healthcare system, to transform the services that individuals living with type 1 and type 2 diabetes encounter. Then we have Steno Diabetes Copenhagen, which is based in Denmark, which also is using value-based healthcare principles for type 1 and type 2 diabetes. Then lastly, we have NHS Wales. And what is also interesting about NHS Wales is you're actually looking at value-based healthcare implementation at a national level. So the interesting thing about the first cohort is you start to see the diversity of how value-based healthcare has been implemented and also where it has been implemented, because each of these countries, they have their own different health systems. So kind of looking at how value-based healthcare is also implemented across different health systems and also across different disease areas from acute to chronic diseases. So what is very important for us with the innovation hub is their purpose is to be able to share the learning, to learn from them, and to be able to develop methodologies and tools that can be widely accessible, and to help other stakeholders to be able to scale up when it comes to their health system transformation and be able to realize the full potential of value-based healthcare. So with the hubs, with the 4 innovation hubs that I mentioned, and you can see on my screen, what we've done with them is, although they've been qualified as the Global Innovation Hub, it is also very important to us that we work with them over the next 2 years to do 2 things. One, to continue to place them as a thought leader when it comes to implementation of value-based healthcare. And second, it's also very important that we work with them to continue to improve on their journey towards a value-based healthcare system. Like I said, there's no perfect system. These systems, yes, they serve as a proof of concept, but they also room for improvement for all of them. So what do we plan in terms of what their 2 years engagement journey will be like? And this is a 2-year engagement journey that we would have for any of the hubs that get qualified on our platform. One, it is very important for us that we're able to establish a community and build a network amongst the innovation hub. So right now we have 4 hubs that have been qualified, but our goal is that by the end of 2021, we would have qualified 15 hubs. So we start to have a robust community, and it's very important for us that we're able to create a network among this community where they can learn amongst themselves, because it is very important that they are able to showcase what they're good at, make that knowledge accessible within that network, and leverage the network that they're part of. The second is to position them as thought leaders in this space. So how can, for example, the likes of Health Cluster Portugal demonstrate how they've been able to use value-based healthcare for cataract surgery? So this will be done by codifying best practices. So how can we look at what they've done, their implementation of prompts, their implementation of prems, their journey on value-based payment? How can we use all of that, looking at their policy framework to be able to codify best practices for Portugal and also beyond Portugal? Because for us, what we really want to create is a truly global learning ecosystem. So how can we position these innovation hubs as a truly global learning ecosystem? Also, with the innovation hubs, one of the things that they're all passionate about is how can they mentor other pilot initiatives? How can they mentor other pilot initiatives that are currently at the beginning of their journey on value-based healthcare? And how can they help them to accelerate that transition? Also, what is important for us is, like I mentioned, is to make this knowledge accessible. So they make the knowledge of what has made Health Cluster Portugal successful when it comes to their value-based healthcare cataract initiative. Same goes for diabetes, steno diabetes, NHS Wales. So how could we make that widely accessible to the public and they can learn from these innovation hubs? One of the things I've mentioned is, for us, we really have a rigorous process in place to be able to qualify an initiative as a global innovation hub. And how do we do that? It takes a 3-part process. One is we have a pre-application phase where we invite any initiative that believes they are a value-based healthcare initiative to apply. Once they've applied, we actually review their submission. And if they've been able to demonstrate that they're a value-based healthcare system, then we move them to the second stage, which is more of when the rigor of the assessment begins, which we then have a phase where we call the maturity assessment. And what we do here is we want to assess their readiness to move towards a value-based healthcare system. And while we're doing that, we also would schedule different stakeholder interviews, because not only are they completing the maturity assessment, we have to be able to do our due diligence and do really probe that they're actually really doing a value-based healthcare and they're implementing value-based healthcare principle. What we've put together is to be able to do that, we have put together 8 assessment dimensions. And we assess each of these orbs across all of these 8 dimension areas. So the first one, the first group, which we call behaviors, these are actually the foundational principles of value-based healthcare. Like I said, we have to be able to measure value because we're focused on values that matter to the patient. So how do we track the outcomes that matter to the patient? And how do we link that to the cost? We have segmentation. So by focusing on distinct population segment, we can start to compare different outcomes and identify the cost of some of those conditions. And then we start to move to segmentation-specific intervention. And what happens with segmentation-specific intervention is basically by segmentation, we're now trying to kind of customize and define multiple pathways. And the goal is that we're then able to use that information to be able to develop a more precise and personalized care. And then the other 5 assessment areas, which I already mentioned at the beginning, are the enablers. So really, we go through each of this. We have our probing questions. We do the stakeholder interview to really ensure that each of the innovation hub are actually doing and implementing this all these principles. And to be able to do due diligence, we put together an expert review committee. And these are individuals that have expertise when it comes to value-based healthcare. Because like I said, it's very important to us, especially if you're going to qualify Innovation Hub, we want them to serve as a proof of concept. We want to make sure we've done our due diligence and we have the right, expertise in the room that can help us to review the information that we collected and to be able to make a recommendation for the qualification of the Innovation Hub. So how do we select this hub? This is just in a quick nutshell. So like I mentioned initially, we have our pre-application phase. Once we receive the pre-application, we review the application. We invite our expert review committee to review those applications, then shortlist the candidate that will move to the second stage. Once they've been shortlisted to move to the second stage, then we'll begin our really rigorous due diligence process. Once we've completed that process, then we also present all our findings to the review committee, the expert review committee, and then based on the information that we've collected and also based on their interaction with each of those hubs, then they take the final decision on the hubs that will be qualified as an innovation hub. So it is really a long and rigorous process. Like I said, it's very important for us that we find one initiative that are proof of concept, that are evidence-based, and that can help to scale up and accelerate the transition towards a value-based healthcare system. So in addition to the work that we do when it comes to the Innovation Hub, we also have the Value in Healthcare Enablers community. And the goal of the Value-Based Enablers community is 2 things. One is to complement the work that we're already doing with the Innovation Hub. If you recall, one of the things I mentioned is there's no perfect system, there's always room to grow. And that's why we have this Value in Healthcare Enablers community where we can also work with our Innovation Hub to position them in the areas where they've already achieved a good expertise. And there's still other areas where they already they have the knowledge, but they want to continue to improve. So we use the enablers community for them to also contribute their knowledge. And also the goal of the enablers community is one of the things that we start to see as we start to implement value-based healthcare is you start to see different pockets. And what do I mean by different pockets? You start to see some great examples, maybe when it comes to value-based payment. You start to see an example when it comes to integrated practice models. So how can we ensure that we also learn from those pockets that exist, that maybe they don't exist, for example, in a comprehensive system like Costa Portugal and what they're doing for their Cataract initiative, because it takes a long time for you to be able to develop a comprehensive system. So how do we make sure we actually don't miss out on maybe those entities or organizations that maybe has one specialty, maybe value-based payment or integrated practice model? So what we want to do is identify these examples. How can we learn from them? So what are their challenges? What are their opportunities? How was it implemented? So we take this opportunity to learn from them and then codify this as best practices and make it widely accessible. And the goal for the Value in Healthcare Enablers community is basically to ensure that we can codify this knowledge that if you have any organization or entity that maybe is interested in implementing value-based payment, they're not going to be starting from scratch. They can already have a place where they can go and say, okay, oh wow, these are some of the 10 best examples that exist when it comes to value-based payment, or of course, different aspects of value-based payment, and they can start from that. So for us, this is how we truly see that we can start to accelerate the transition to a value-based healthcare system, to shift the myth of, this is a theoretical exercise, but actually shift it to something that is practical, something that can be implemented, and something that is done. And like I said, with the example of Cluster Portugal, with what they're doing with Cataract, it kind of starts to show other people that, okay, wow, this actually can be done. It's not just a theory, there's actually implementation of it that exists. So for us, this is really what we want to achieve with our platform, with the Global Innovation Hubs that we've been able to qualify, and with the work that we do on the platform is, one, to identify the gap. What are the gaps that exist when it comes to the implementation of value-based healthcare? And how can we use our platform to be able to accelerate and transition to a value-based healthcare system, and working with initiatives like Health Cluster Portugal, working with Steno Diabetes, working with Diabeta, and working with NHS Wales and other innovation hubs that will be qualifying throughout the year. So for us, I think the work is just beginning because there's still a lot that needs to be done, but I think we are really at a really great pace where we can use the information that we're now gathering to be able to accelerate and transform our system. So so this is what we're doing at the World Economic Forum, and happy to take any questions. And you have my contact information. You can reach out to me, and also we have our website as well to learn more about the project that we're doing. And I just want to say thank you again for giving me this opportunity to talk about the work that we're doing at the World Economic Forum in the value-based healthcare space, and how we're using this work to be able to transition and transform the healthcare system.
Good morning. My name is Joaquim Murta. I am the chairman of the Department of Ophthalmology in the University Hospital of Coimbra. I am also in the board of HCP, Health Cluster Portugal, and I would like to thank this kind invitation to talk about value-based healthcare, and I'm going to talk about the clinical impact of value-based healthcare in our health systems, as well our project in Portugal in the cataract surgery. In 2013, Michael Porter introduced for the first time value-based healthcare, and with this paper, the strategy that will fix healthcare. And he proposed to move away from a supply-driven healthcare organized around what physicians do toward what the patient's needs, and a shifting of the focus from the volume and profitability of the service to the patient outcomes that are achieved. Maybe you don't understand this reading this, but it is a news that was published in a newspaper, talking about 15,000 of surgery that were performed outside of the health system in the private in 2020. But there is no evaluation of this surgery that were performed in the private. It's not talking about private or public, it's the same in both systems. So currently, very few health systems assess impact on quality of life from the perspective of the people they serve. The fee for service model incentives, so based on volume, can generate over-medicalization and wasteful spending, as well as unnecessary treatments that can be performed without complications and remaining undetected, despite the fact that they not enhance patients' quality of life. In living in this pandemic situation, I think that's the real point and the good point to do on to create and to improve a new health strategy supported by digital skills to drive health transformation and to improve the health, the patient healthcare. So the transition to value-based healthcare is fundamental, continuously improving the relationship between outcomes and costs. And it's the only way to ensure long-term sustainability and better health outcomes for our patients. This is a document that was published in 2020, Implementation-Based Healthcare in Europe, a handbook for pioneers. It was published by ehealth, and that we can read what are the needs and the important things in these implementations. I can summarize this in the critical key dimensions. So recording refers to measuring process and outcomes through a scoreboard and data platform. Comparing refers to benchmark teams through internal and external reports. Rewarding, it's fundamental, refers to investment resources and creating outcome-based incentives. We will talk about it a little bit later. And improving refers to organizing through a collective learning and partnership. So to the implementation, it's necessary that it requires a clinical and administrative levers working together. It's important to find excellent clinicians willing to measure their outcomes and to be transparent with their peers and patients. It is very important that this team should be motivated to dedicate its time and efforts to measuring outcomes. And in the beginning, it's necessary to focus on one specific condition. It's for that reason that we began with the cataract. Investments. The main investments are human resources, a small project management team, and its fundamental integrated IT infrastructure. About the incentives, this is a key point in this all this process, because recognition and money strongly influence human behavior on both individual and collective levels. Outcome variation is impacted by payment models, and value-based healthcare offers economic incentives ranging from outcome-based contracts to value-based procurement. So the economic incentives drives behavior change in all health professionals, and it should compensate all the entire care team involved in this process. So to the community, the key question raised is to not who is the best, but rather how can we improve? It stimulates active learning and will transform clinical research through new clinical trial paradigm, registry-based randomized trials. In the health, what is the Health Cluster Portugal? Health Cluster Portugal is a private non-profit organization that have at this moment almost 200 members, including the R&D institution, university, hospitals, organizations from civil society. And in 2018, we organized an ophthalmology subcluster in order to implement value-based healthcare in two pathologies, cataract and AMD, age-related macular degeneration. So we involve public hospitals, we involve private hospitals, and we involve the industry, and that these were the companies, the pharmaceutical companies involved in this project. We based our study and our project in the ISHAM standard sets with three main topics: patients perspective, provider perspective, registry perspective. And why cataract at the beginning? Because cataract is disease that is unavoidable with age, that affects people's quality of life and ability to be active, and is the highest volume worldwide, is one of the highest with cost-benefits ratio. And the cataract surgery in the last years, had a tremendous development. We can correct astigmatism, hyperopia, myopia, presbyopia, difficult to read near. So a tremendous development was observed in the recent past. Just a figure too, this is a patient who have surgery, cataract surgery without astigmatism, and the same patients. It's a simulation, but the same patients with astigmatism. So we based our study in the cataract surgery standard sets, but it was necessary to do an update, an improvement of these standard sets, because they were made to monofocal IOLs. So the minimum standard set, it's the same, preoperative, intraoperative, and postoperative. But we had a lot of more information to be included in the project: demographics, comorbidities, glaucoma, AMD, diabetic retinopathy, etc. The technical and the IOL type, monofocal, multifocal, which is very important to see far, intermediate, and near vision, and correct toric or non-toric. Toric or non-toric is related with the correction of the astigmatisms. All outcomes were case-mix adjusted, not only for the clinicians, the cross, but as well for the patients, the proms. So the outcomes and the patient, it was necessary to fill a questionnaire in the beginning, before the surgery, and after the surgery, after 6 months of the surgery. There was a questionnaire, it's validated, a very simple questionnaire to the patients, where they answered if it was possible to reading text in the newspapers, recognizing the faces of people that he meets, seeing to do handicrafts, woodwork, or seeing to walk on uneven surfaces, which is very important for elderly people. The timeline was before the surgery, as I told you, and 6 months afterwards, not 3 months like in iShone standard sets, but 6 months, because we include multifocal IOLs, and there is a process of neuroadaptation that is going until the 6 months after the surgery. So the challenges were agreeing a common standard set, ensuring that full coverage of reporting, 80% of all the surgeries, cataract surgeries, were included in project, implementing internal and external audits at each site, and using a common efficiency data entry and analysis performed in all the institutions. In the next step, we are beginning with the AMD, with the age-related macular degenerations. This is a key point in this process. This is a paper published in 2018. Is a very I recommend to see this paper. And in 2016, a study found that physicians spent 2 hours doing computer work for every hour spent face-to-face with the patient. And physicians devoted half of their patient time facing the screen to do electronic tasks and not to talk with patients. And it's for that reason that the title of this article is "Why Doctors Hate Their Computers." So it was necessary to include an IT startup, and we chose Promptly, which is a Portuguese startup focusing in unlocking the power of outcomes-based care. So it should be a very easy process for the clinicians and for all the health professionals. This is the first report. We are going to publish every year one report. This is the clinical outcomes cataract, the annual report in 2020. I'm not going to describe all the results, but just a few. And we see here about the proportion of patients with more barriers performing daily activities after surgery. And there was differences between the clinical reports and the outcome reports. And the same as well in the CatQuest, between the CatQuest for the patients and the clinical reports. There is about 10%, and the same in the visual acuity. There is a 10% difference between the reports of the clinicians. The clinicians said that everything is very good, but the same questions when they were raised to the patients, there is a 10% difference. So the patients didn't have their improvement in the quality of life and vision in the same surgeries. So 1 year ago, more or less, with the support of Alcon, we submitted the HCP, the Health Cluster Portugal, submitted the World Economic Forum this project, and the World Economic Forum distinguished this project as a global innovation hub. This distinction, as you know, is awarded to the most advanced and impactful initiatives in the world that demonstrate leadership in the implementation of value-based healthcare models with significant impacts on the patients, and giving them the opportunity, and this is very important, to make well-informed choices regarding their healthcare. So what are the next steps that we are dealing? Expansion of the project, new centers and new pathologies, benchmarking, transparent benchmarking, learning, because this is a process of collective and active learning with community, with research, and with training. Incentives, which is a very important topic, defining outcomes-based payments, information dissemination of the results to all the population through a website. The population should know about results, and the population, the people should be very well informed in order to do their choices, where they should have the surgery or where should they have the treatment. Economic analysis, and Krystina is going to talk about this. Evaluate the inclusion of new metrics, evaluating outcomes in premium surgery, innovative cataract implants, astigmatism, presbyopia, so in PROMs and CROMs. And it's for this reason that the interaction of industry, they are very interested in this kind of projects, materials, drugs, etc. And last, but it's a very important topic, it's the definition of incentives with Ministry of Health and insurance companies in order to do the incentives based on the value created through this process. So we are doing also what is the value of care of healthcare intervention for each patient, but it's something that Krystina, the next speaker, will talk about. And this is the main aspects that I would like to talk and to transmit. Thank you very much for your attention.
Hello, and thank you very much for the opportunity to participate in this panel. My name is Krystina Dziekan. I head up the market access function for Alcon Surgical in Europe. The topic for this talk is really about how value-based healthcare is able to unleash economic value. Usually in healthcare decision-making, what we're facing is how to get the best care to the patient, but within a very finite budget. And often innovative care and good economics seem to be at conflict with each other because affordability becomes an issue. Now, value-based healthcare recognizes that care excellence and good economics absolutely need to go hand in hand. And it's putting the right mechanisms in place to ensure that becomes the case. Now, through transparent outcomes data capture and encouraging a learning cycle, care will automatically gravitate towards what works best, and thereby eliminating inefficiencies in the form of suboptimal care, which are often associated with much higher costs, such as repeat interventions or longer lengths of stay. At the same time, also, outcomes capture enables payers to incentivize on value rather than volume of care, and therefore aligning every stakeholder and decision maker around those outcomes. Now, I will bring this to life also with some examples from cataract care. Cataract is an inevitable fact of aging. It will eventually affect all of us. Now, cataract surgery can very effectively restore this clouded vision and is very cost-effective as an intervention. And as such, it's being paid for across Europe in all public healthcare systems. Now, given the aging demographic, it is also among the top most frequently performed surgeries throughout, with 5 million surgeries performed in Europe alone, at a cost of about $10 billion annually for the public healthcare systems. Now, one would imagine with all this experience, outcomes as well as surgical processes are pretty standardized. However, huge variations in outcomes still exist also in cataract care. And these variations pose a significant economic problem. Now, I'll illustrate with a few examples here. Across Europe, there is an 8 times variation in patient waiting times for surgery from time of diagnosis. Waiting times means deteriorating vision and often also an increase in the risk of falls for the patient. Falls are very costly. In the UK, it has been estimated that the cost of falls due to visual impairment amount to over £20 million a year. And now with waiting lists only increasing during the recent pandemic, that cost across Europe will increase even further. Now, a second example is regarding intraoperative complications. Capsular complications are a risk of cataract surgery, and there's a more than 4 times variations in capsular complications depending on care setting. Now, while absolute rates are not very high, the costs associated with each case when it does occur are significant. Again, in the UK, it has been shown to amount to about £1.6 million annually, the direct costs of capsular complications. And a third example concerns long-term complications of cataract surgery. The development of posterior capsular opacification or secondary cataract is the most common adverse event, long-term adverse event. It's a renewed clouding of the lens that can occur several months or even several years after surgery. Now, data shows that there is a more than 10 times variations in PCO occurrence across healthcare settings, ranging from less than 5% to more than 50% in some settings. Now, PCO is treated with a laser intervention. And that laser intervention not only carries some risk for the patient, but also a cost. At £130 in the UK per laser intervention, and more than 60,000 such interventions performed in the NHS every year, this amounts to a cost of over £8 million every year. Now, if we look at the significant economic burden associated with variations in outcomes, we realize if these outcomes variations can be reduced towards the lower end of the spectrum, significant resources in healthcare systems can be freed up that can be invested elsewhere much more productively. And this is where payers come in. Payers have a very important role to play in aligning incentives around value and encouraging this continuous learning and improvement. Here's an example from Poland. Prior to 2015, cataract waiting lists in Poland increased to unsustainable levels. And the government decided to invest increased budgets in cataract care to make sure that capacity could be increased. As a result, waiting lists came straight down. Now, the government decided to make this change last, to implement a data portal and require public hospitals to report pertinent outcomes data on a regular basis for every patient to see and have access to. By making such important outcomes data transparent, the government has encouraged an ongoing benchmarking and improvement cycle as well. Similarly, in the UK, back in 2017, the National Institute for Health and Clinical Excellence issued very comprehensive cataract guidelines. In these guidelines, it pinpointed to the problem of PCO rates or secondary cataract and high rates of variation being an economic burden. So following on in 2019, under the umbrella of getting it right the first time, the NHS adjusted financial incentives. And it increased the reimbursement tariff for primary cataract, but it decreased the reimbursement tariff for the laser intervention required to treat the PCO rate, so the secondary cataract occurrence, thereby disincentivizing that adverse event. It also encouraged putting in place a product outcomes registry to be able to show what factors contribute the most to PCO rate. And just this May, the National Ophthalmology Database released such a registry data report with data from over 600,000 patients across 60 centers in the UK, reporting on factors contributing to PCO rates. And that report sheds important light on factors such as lens material and others that can significantly help reduce PCO rates in a sustainable manner. Therefore, encouraging and aligning incentives around data capture and continuous learning have a powerful role. Many medical supplies also need to be procured through tenders. And public procurement in particular is another important avenue where value can be incentivized. Increasingly, procurers are shifting towards a concept of value-based procurement to set the right incentives around outcomes parameters and cost parameters that matter. And in the case of cataract, that could be setting specific criteria for suppliers to prove with pertinent evidence how their products help contribute to great visual outcomes and to the reduction of undesired adverse events. On this slide, you see an example from a health insurance company in the Netherlands that contracted with hospitals exactly around these types of outcomes and cost parameters very successfully. So in summary, by focusing on outcomes that matter to the patient, value-based healthcare approaches are able to incentivize all stakeholders touching the patient care, the clinician, hospitals, medical science, life sciences companies, all around delivering innovation that best encourage care excellence as well as efficiency in the systems. And payers, and I would argue as well, procurers have a really important role to play in setting the right financial incentives to make that focus on value deeply embedded in healthcare system delivery. Thank you very much.